Good morning everyone. My name is Dr. Ankit Sharma, HOD and Associate Professor in Shalakya Tantra Department, IIMT Ayurvedic Medical College and Hospital, Meerut. And today's my topic is Kriya Kalp. Before I going to jump my topic, I just want to explain what is Shalakya Tantra. In my next slide is Shalakya Tantra. As you know that it having two words, Shalakya or Tantra. Shalakya is above the clavicle, whatever the sense organ we have, that in that we treat all the sense organ over there in Shalakya, and Tantra is a science. So Shalakya is a Shalaka karma Shalakyam tat pradhanam tantramapi Shalakyam. Shalaka yat karme kiryate Shalakya. Shalaka, by using the Shalaka is a probe actually. By using the probe, when we treat the disease, that science is called Shalakya Tantra. Again, Shalakya Niruti, Shalaka yat karme kiryate tat Shalakyam. And the definition of Shalakya is Shalakya nam udru jatru gata nam sarvan nayan vadanam granadi shanshata nam upsam nam tarcha. As you already told you, Shalakya Tantra is Jatru Asti. In Ayurveda, we call Jatru Asti as a clavicle bone. Above the clavicle, whatever the sense organ we have, whatever the organ we have, we deal all the sense organ over there. Like Sarvan. Sarvan is a karna, ear. Nayan is eye. Vadan is a mukha. Nasa is a nose. And Sira is my head. So all the disease, when we as it's all our disease are coming above the clavicle, so we deal all the disease over in Shalakya Tantra here. Shalakya Tantra, as you know that Shalakya having 8 branches. In Shalakya Tantra is one of them, as Kai Bal Gharo Drvang Salya Drapsta Jaravarshan. काय बाल घरो उद्ध्वांग, काय चिकित्सा, बाल रोग, ग्रह मतलब ग्रह चिकित्सा, उद्ध्वांग मतलब ऊर्ध्व अंग इज नथिंग एज Shalakya Tantra ओनली. उद्ध्वांग द्रमष्टा इज अगध तंत्र. और वर्षान में इट मीन्स रसायन चिकित्सा. तो इट्स वन ऑफ द Stanga Ayurveda. Now is my main topic is Kriya Kalp. Kriya Kalp. What is Kriya Kalp? It having two words, Kriya and Kalpa. Kriya is a procedure. Kriya is a topical ocular therapy, and Kalpa is a medicated formulation. When we use the medicated formulation as a procedure in ENT diseases, that form is called Kriya Kalp. Kriya Kalp. Acharya Shushruta mentioned 5 types of Kriya Kalpa. That is Tarpan, Putupaka, Sek, Asuchotan and Anjana. And additional Acharya Vagbhat or Acharya Charangdhar added 2, one of them is a Pindi and Vidalaka. So according to Vagbhat and Charangdhar is 7 in number, or according to Acharya Shushruta is 5 in number. Avastha, in which condition we have to go for this Kriya Kalp procedure. As you know that here is mentioned that Nirama condition or Samaja condition. When the person having the Niramaja condition, Niramaja, as you know that I already deal with the Amaja and Niramaja case in previous classes. So in Niramaja condition, we can go for Tarpan, Putupak and Anjan Kriya or procedure. And in Samaja condition, in Amaja condition, we can go for Seka, Asuchotan, Pindi and Vidalaka. Next slides. First one is Asuchotan. What is Asuchotan? Installation of the medicine in the form of drop from a height of 2 angula is called Asuchotan. As here mentioned, Asuchotan is Sarva Akshi Rogastik Upakarma. Sarva Akshi, whatever the disease we have in the eye, the whole disease can cure through Asuchotan. Asuchotan here is mentioned is the first line of treatment of ocular inflammation condition like Sofa, Raga, Dha, Ashru and Toda. Sofa is the inflammation, Raga is a congestion, Daha is burning sensation, and Ashru is excessive lacrimation, and Toda is a pricking pain. So in all conditions we can go for Asuchotan. And second is a Sheka. Sheka, it's also called as a Parisheka. Parisheka. Sekastu Suksma Dhara bhi Sarva Asmina Hitam. Procedure of pouring the liquid medicine over the eye from the 4 angula, above the height of 4 angula of the eye. When we pour the medicine on the patient's eye, that condition, that procedure is called Seka. We use the medicated formulation over here, and that in that condition, indication of the Asuchotan, but in fulminating a stage, Balavtara condition of the Netra Roga, we can go for the Sheka. Asuchotan and Sheka is a differentiate only by the Roga Avastha, Oshadha Dravya, Matra, even Prayoga Kala, nothing else. And third one is Vidalaka. Vidalaka, as you can see over here, that the patient, you can see the one picture over here, that just leave that eyebrow and we are pasting all the medicated powder over there. The here Vidalaka is Vidalako Bahi Lepum Netra Pakshma Vivarjite. Pakshma is eyelids. The application of medicated paste over eyelid excluding eyelashes. So excluding eyelashes, we apply paste over the eyes is called, that process is called Vidalaka. Indication is that Tarun Netra Roga Ashru Sarva Vedana Toda Kandu Shotha. As already mentioned in Asuchotan, as that condition is coming under the Vidalaka also. And the Matra will be Ardha Angula, and take it off before it fully dry. Okay? When it's completely dry, then we can take out. Pindi, as name suggests, is that Pindi is a round shape, is like a ball shape. And Pindi Kavilika Prokta Badhyate Patvastraka. In this paste of medicine are covered in a cloth, and placed over the closed eye. Pindi is a modified procedure of a Vidalaka and more effective comparison on the Vidalaka. Also called as a Kavalika. It's a medicated paste. When we fold into the patta is a vastra, and we fold and we apply over the eye. That procedure is called Pindi. An indication as Vidalika mentioned here. Tarpana netra tarpati karam parama. Local procedure of pouring of oily substance through a specifically prepared border over the eye for the separate period. Nourishment of the eye. Tarpana, as name suggests, is Tarpana. When we eye having the Vataja condition. Vataja condition is when Vataja guna is predominant over here. In that condition, we can go for the Tarpana procedure. As average time of Tarpana is 20 to 45 minutes. Quantity approx 20 ml each eye, and can be advised 3, 5, 7 days. Puttapaka. Puttapaka is the procedure same as like mentioned here over here is Tarpana, but the ingredients is changed. In that Tarpana we can use the oil or ghrut. In here we can use Swarasa, is medicated paste. And pouring a lukewarm water medicated juice help to Puttapaka Vidhi through a specifically prepared border over the staphying procedure, in that called Puttapaka. Can be done after the Tarpana immediately. After Tarpana we can go for Puttapaka procedure. And the indication for sharpness of your vision. Anjana. Anjana anikti anena iti anjanam. Anjana, as you know, that the kajal we apply over here. That likewise the Anjana is like that. Procedure of applying the medicine paste over the inner eyelid of eyelids, either finger or with the application of Anjana Shalaka. And other procedures in Shalakya Tantra we are not going to deal today. And that. Okay, thank you.